Welcome to today's Explainer. We are jumping right into a topic that honestly doesn't get nearly enough clear, straightforward attention, and that is proactive pelvic health for men. We're taking a premium, fully science-backed look at a practice that can absolutely transform your daily life and improve your overall health. Forget all the awkwardness, and definitely forget the confusion. Today, we're breaking down a powerful yet incredibly subtle technique that you can do literally anywhere to build some incredible foundational strength.
But right off the bat, I've got to ask, are you doing Kegel exercises wrong? Because, if you've ever looked this up online, you've probably been hit with an absolute avalanche of overwhelming and frankly, completely incorrect advice. The internet is literally flooded with all these complicated routines that leave most guys way more confused than when they started.
So, to cut through all that noise, you should know the technique we're about to reveal isn't just some passing fitness trend. It is deeply grounded in 15 years of clinical observation and real patient success. After a decade and a half of working directly with patients, medical professionals have pinpointed exactly what actually works, stripping away all the unnecessary nonsense to find the single most effective method out there.
Okay, let's dive into this. Here's our roadmap for today. We'll start with the Kegel confusion. Move into understanding the pelvic floor, go over the 5-second technique, look at the major health benefits, and finally, break down the timeline to real results.
Starting things off with part 1, the Kegel confusion.
And this brilliantly illustrates the exact problem we were just talking about. On the left side, you've got the internet myths. You'll find these so-called gurus telling you to treat this like a heavy gym session. I'm talking holding weights in your hands, doing wide leg squats, attempting impossible 100 repetition sets, or trying to do agonizing 10-second holds right out of the gate. It's exhausting just reading it, right? But look over at the right side. The reality is incredibly elegant in its simplicity. Real, clinically effective Kegels are just a simple, isolated muscle contraction. No weights, no gym clothes, no complicated stances. Just you and your body.
Which brings us to part 2, understanding the pelvic floor.
So what exactly is this pelvic floor we keep talking about? Well, clinically speaking, it's that crucial group of muscles located around the anal passage and running right behind the testicles. Think of it as a muscular hammock that supports your internal organs and is directly responsible for your foundational bodily control. This specific targeted area, the muscles deep down within your pelvis, is exactly what we want to isolate. We aren't working the legs, we aren't working the abs, we're focusing purely on this vital internal support system.
All right, moving right along to part 3, the 5-second technique. Now, I actually want you to try this with me right now, wherever you are. Whether you're sitting in an office chair, resting in bed, or even driving a car, you can do this. Here's the simple 3-step process. First, imagine you're trying to stop the flow of gas in a dead silent meeting, or maybe trying to stop the flow of urine midstream. Feel that internal upward pull. Isolate and squeeze those specific pelvic muscles, pull them up and hold them tight for exactly 5 seconds. Then, step 2, completely release and relax them for 5 seconds. Finally, step 3, you just repeat that simple cycle 10 times. Squeeze for 5, release for 5, 10 times. That's the whole shebang. That is your entire baseline exercise.
But listen, technique is absolutely everything here. Correct execution means you have to keep breathing normally. You are isolating only the pelvic floor. The absolute most common mistakes people make are holding their breath, fiercely tensing up their stomach, or arching their lower back. Actually, if you are tightening your abs or holding your breath until your face turns red, you are completely defeating the purpose of the exercise. You've got to relax your body, keep your breathing nice and steady, and let only those hidden pelvic muscles do the work.
Now, before you run off and make this a daily habit, pay close attention to this crucial clinical warning. You should never, ever do Kegel exercises when you have a full bladder or feel the need to use the bathroom. Practicing these contractions with a full bladder or bowel can actually backfire on you, and it can lead to internal stomach aches or bladder pain. So always make sure you're comfortable and empty before you start knocking out your reps.
As you get more comfortable with this routine and truly master how to isolate that muscle, you can definitely begin to scale it up. You'll literally feel your muscle awareness grow over time. When that happens, simply increase your repetitions from 10 up to 15 or 20 per session. You can even start doing a set in the morning and another set in the evening. It's a very gentle, natural progression as your internal strength builds up.
This naturally leads us to part 4, major health benefits.
Now, what's really interesting here is how much this improves your overall day-to-day health. By strengthening that pelvic floor, guys are seeing dramatic, genuinely life-changing results. For starters, it provides tremendous relief for premature ejaculation. It actively combats age-related erectile dysfunction by improving blood flow and muscle tone right in that crucial region. For older men, or really anyone dealing with annoying urine dribbling, this restores powerful, confident bladder control. And here is the absolute best part. Clinical studies and patient histories are showing that for many men, this acts as a permanent cure to these issues. And you're achieving all of this entirely without expensive medications, without constant doctor visits, and without a single piece of specialized equipment.
Finally, Part 5, Timeline to Real Results.
Let's be real for a second. This isn't some 4-day magic trick. In days 1 through 5, you probably won't notice any results at all. And hey, that is completely normal. But right around week 2, that's when the magic starts happening. You'll begin to notice initial improvements in your bladder control and noticeably better, stronger erections. As you push into weeks 3 through 6, those cumulative results really emerge and solidify for the vast majority of men. From there, it transitions into lifelong, permanent maintenance. It is a scientifically proven process for sure, but it does require your dedication to get past that first quiet week. So, the crucial point is this. We really need to reframe how we think about our pelvic health. Kegel exercises are not some temporary medical course you do for a month and then just forget about. I mean, you wouldn't go to the gym for a month and expect to stay muscular forever, right? It's exactly the same here. This is a lifelong fitness habit. It's all about maintaining peak physical function for the rest of your life.
Which leaves us with one final, very important question for you. Will you start your 5-second habit today? You've got the technique, you know the amazing health benefits, and you can literally do it while you're sitting right where you are watching this. I highly encourage you to start this journey immediately. Try it out and please drop down into the comments and share your experiences or any questions you might have. You never know who else in the community might benefit from your insight or have the perfect answer for you. Thanks for joining me on this explainer, and best of luck building a stronger, much healthier foundation.